1. Rushing. It like you're still a young man, the hidden strain of speed in. Your younger years, everything was faster. Your thoughts, your reflexes, your recovery time. And yes, even your climax. Back then, it wasn't uncommon to finish quickly and move on with your day, no harm done. But now, rushing through morning masturbation, often before your body is even fully awake, is one of the most common and dangerous mistakes I see men over 60 making. Here's what really happens when you rush. Your heart rate spikes suddenly before your blood pressure has had time to stabilize after sleep. Your pelvic floor muscles tense too quickly, creating micro-strain in the lower abdomen and perineum. Your breathing stays shallow, cutting off oxygen from the very tissues that need it most during arousal. The result? A climax that feels more like collapse. You may feel lightheaded, oddly fatigued, or even slightly irritable. Some men assume this is just aging, but it's not. It's misuse. And what worries me most is this. Over time, this rushed routine teaches your nervous system to associate arousal with anxiety and tension, not pleasure and vitality. That's how sexual burnout begins, not with a big bang, but with years of hurried, thoughtless repetition. Let me be clear. This isn't about shame. It's about rhythm. Your body is still capable of beautiful, satisfying pleasure, but it needs to be invited, not forced. At this stage in life, intimacy must be approached like meditation, not a sprint. What to do instead? Here's what I recommend to my patients. Start with deep breathing. Inhale for 4 counts, exhale for 6. Do this for 1-2 minutes before any stimulation. Stretch lightly. Even just rolling your shoulders or doing a few hip circles can awaken blood flow. Engage your senses. Instead of going straight for climax, explore what feels good. Touch, temperature, even memory. The goal is to bring the nervous system with you, not leave it behind in the rush. In other words, your sexual energy isn't gone. It's just waiting for you to meet it with presence, and that presence begins with slowing down. Masturbating, before hydration or movement. The silent shock to your heart and hormones, you wake up. You're still groggy. And without even getting out of bed, your hand drifts down, hoping for a moment of release to kickstart the day. But here's what your body is actually going through in that moment. After 6 to 8 hours of sleep, your body is naturally dehydrated, your blood is more viscous, your circulation hasn't fully restarted. Your heart is still adjusting from deep rest to alertness. And yet, without so much as a sip of water or a stretch of your legs, you're triggering a cascade of physiological events, demanding arousal, blood flow, and muscle contraction from a system that hasn't been primed. This is where the danger lies. I've had patients in their 70s tell me, "Doc, I feel more drained than satisfied after my morning routine." Some feel a racing heart. Others experience dizziness or an odd heaviness in their chest. A few even suffer episodes of anxiety or palpitations, never realizing the link. As a urologist, I've also seen the silent long-term effects of this pattern. Lower testosterone response due to cortisol spikes. Poorer erection quality over time, as circulation weakens from strain. Increased fatigue throughout the day, despite having released energy in the morning. Morning arousal demands energy, and if your system isn't supported first, it steals that energy from more vital places like your heart, your brain, and your hormones. What to do instead? Start with this 3-minute reset before any stimulation. Hydrate immediately. Drink 300-500 milliliters of water upon waking. Add a pinch of sea salt or a slice of lemon to wake up your adrenal system. Move gently. Walk to the bathroom. Stretch your arms overhead. Rotate your torso. Movement tells your heart and blood vessels. We're back online. Breathe into the belly. Ground yourself. Give your nervous system a moment to catch up to your desires. Only after this short routine should you consider stimulating your body. pleasure is not a race. It's a biological dialogue. And your body, especially after 60, needs to be spoken to with respect, not demands. Morning masturbation can still be part of a healthy routine. But like all good things in life, it must begin with preparation. Morning porn. How digital stimulation is numbing your real desire. Let me ask you something difficult. When was the last time you felt genuinely aroused, without needing a screen? If you're like many of my patients over 60, the answer is uncomfortable. Not because desire is gone, but because it's been hijacked. For decades, men have been quietly turning to pornography as a quick fix. It feels harmless, especially first thing in the morning when dopamine levels are high, testosterone is peaking, and the house is quiet. The phone is within reach. Just a few clicks, and it's done. But here's the uncomfortable truth. Your brain doesn't forget what you feed it. And every time you watch pixelated strangers perform exaggerated acts, your brain rewires itself, away from reality and toward fantasy. In your youth, your arousal system was resilient. But after 60, your dopamine production slows, your receptors become more sensitive, and your emotional wiring becomes more fragile. What does this mean? It means that daily morning porn, especially when combined with rushed stimulation, can gradually dull your brain's response to real-life intimacy. You may still feel desire, but it becomes harder to connect with a real partner. Your senses become muted. Your imagination loses its edge. And worst of all, you may begin to feel disconnected from yourself. Many men describe it like this: I still do it, but I don't feel anything. It's like going through the motions. I climax, but I feel more empty than before. As a doctor, I see the long-term consequences: erectile desensitization, delayed or absent orgasm, emotional numbness, a quiet but powerful erosion of self-worth. What to do instead? If this speaks to you, don't panic. It's not too late to reset. Here's a practice I recommend to older men who want to reclaim their natural arousal. Go on a 7-day visual detox. No porn, no erotic images. Let your dopamine receptors breathe. Use memory instead of media. Recall a sensual moment from your past. Even simple memories of touch, connection, or warmth can reawaken real desire. Touch with presence. Don't just stimulate. Listen, explore. Let your body surprise you again, and if you feel resistance at first, that's normal. You're not just rewiring habits, you're reawakening your humanity. Post-climax pressure. When your prostate tries to tell you something, and you ignore it. After climax, most men want one thing: to move on, get out of bed, take a shower, get dressed. But for many older men, something lingers: a dull ache in the lower pelvis, an odd pressure behind the scrotum, an urgency to urinate, sometimes twice in 10 minutes, or a strange sense of fatigue, as if energy has been drained from somewhere. Deeper than the body, most brush it off. Just getting old, they say. But let me tell you something as your urologist. These are not just signs of aging. These are warning signals from your prostate, and they're asking you to pay attention. Here's what may be happening. As we age, the prostate becomes more sensitive to congestion. When you masturbate too quickly, too forcefully, or too frequently, especially without adequate hydration or muscle relaxation, fluid can stagnate in the prostate ducts. This creates subtle inflammation, not the kind that sends you to the ER, but the kind that slowly thickens tissue, narrows pathways, and reduces blood flow. The result? Post-ejaculatory discomfort. Heaviness in the perineum, the area between the scrotum and anus, a feeling of incomplete urination. Increased nighttime trips to the bathroom. It's not always prostatitis, inflammation, of the prostate, but it's a warning sign on that path. So what should you do? Start by treating your post-orgasm state as a moment of observation, not just dismissal. If you notice consistent pressure or discomfort, here's what I recommend. Hydrate well post-climax. This supports proper urinary flushing and reduces inflammation, too. Avoid contracting the pelvic floor during climax. This takes practice but makes a huge difference. Try exhaling during orgasm rather than tensing. Practice post-masturbation stillness. Lay still for 1 to 2 minutes. Breathe deeply. Allow your body to reset before standing. And most importantly, don't normalize pain or pressure. If symptoms persist, see your urologist. Early intervention can prevent years of discomfort and avoid complications like chronic pelvic pain syndrome or worsening BPH. As I tell my patients, you wouldn't ignore your heart if it ached after exercise. So don't ignore your prostate when it speaks after climax. It's not just a gland, it's part of your sexual identity. Treat it with care. 5. Using morning masturbation to soothe loneliness or anxiety, a silent emotional dependence. There's a silence in the early morning that most people don't talk about. For older men, especially those living alone, widowed, or distant from family, that silence can be heavy. It comes just before the sun rises, before the phone rings, before the world makes demands. And for many, it's the moment when the urge to touch oneself isn't about desire. It's about distraction. I've spoken to countless men who describe it this way. It helps me feel something. It's not even about sex anymore. It's routine. I feel less empty afterward. It gives me 10 minutes where I'm not thinking about being alone. I understand. I truly do. But here's what I also know after decades of clinical observation. When masturbation becomes your primary coping mechanism for emotional pain, it stops being healing and starts being numbing. The act itself is not the problem. The why behind it is. When self-pleasure becomes a way to quiet sadness, suppress anxiety, or avoid deeper emotional needs, it disconnects you further from the very things that bring true vitality: connection, purpose, meaning, companionship. It may feel like relief in the moment, but afterward, it can leave a subtle void, a heaviness, and often, men don't connect the dots. So what can you do? If you notice you're reaching for stimulation when you're not actually aroused, just lonely, bored, or anxious, try these gentle alternatives. Journal for 5 minutes. Write exactly what you're feeling, without censorship. You might be surprised what comes out. Call someone. Even a brief conversation can break the emotional fog and reconnect you to life. Touch differently. Place your hand over your chest or belly. Breathe. Feel warmth. This reminds your body it is held, even in solitude. And if you do choose to self-pleasure, do so with intention. Not to escape something, but to honor something. A memory, a moment of care. A way to reconnect to your aliveness. There is no shame in being human. But there is danger in avoiding your humanity. As I often tell my patients, what you do with your body matters, but how you feel about it matters even more. Conclusion: the new masculinity. After 60, gentle, wise, and powerfully aware. If you've made it this far, I want to pause and honor something important: your willingness to reflect. Because this conversation about masturbation, aging, desire, and vulnerability is one that most men avoid. Not because they don't care, but because they were never taught how to talk about it. And yet your body keeps talking. Every ache in your pelvis, every drop in energy after climax, every moment you touch yourself not out of connection, but out of habit or loneliness. These are not failures. They are invitations. Invitations to pause, to ask, to adjust, to evolve. You see, masculinity after 60 is not about force. It's about flow. Not about how fast you can finish, but how deeply you can feel. Not about conquering your body, but caring for it. Morning masturbation can still be a healthy, even sacred part of your life, but only if you approach it with the same wisdom you've earned from your years, patient, present, and purposeful. Let me be clear. You are not broken. You are not past your prime. You are simply at a new phase, where pleasure comes not from pushing harder, but from listening more. And when you do, you'll discover a kind of strength that isn't loud, but lasting. A kind of intimacy that doesn't require performance, but presence. So I ask you this. Tomorrow morning, when you wake up, what will you choose? The same autopilot pattern that leaves you empty? Or a new, more conscious way to greet your body, with water, with breath, with care? The choice, my friend, is yours. And so is your healing,